Hi, my name is Amy Smith. I'm at Davis and Elkins College and I am achieving my BSN, and I've been a nurse for 22 years and currently I work in the PACU. Today I'm going to talk about improving the communication with handoff reports between the CRNA and the PACU nurse. Just a little funny video. It's an operating table and there's three employees there and the patient is on the floor, and the caption says, "This is why we count to 3. It's called teamwork communication. So my objective is to improve the communication between the CRNA staff and the PACU nurses when they do a handoff report in our phase 1 recovery room. So first I want to talk, what is effective communication? Effective communication is the exchange of information between two individuals, and in our department it's a CRNA and a PACU registered nurse. This process entails complete communication of all relevant information, conveying clear information that can be plainly understood, communicate the information in a concise manner, and offer information in an appropriate time frame. We would like to get a report within 60 seconds of when we receive the patient, once the patient is hooked up to our monitors. And for some reason we have many obstacles that interfere with that in our department. And this report should be done in a quiet fashion, and I know sometimes in a PACU it can get a little crazy, but we need to speak loud enough and clear enough for our nurses to understand. And why is this important? Clear, effective communication is important because many sentinel events are from ineffective communication. And according to the Joint Commission in 2012, 66% of sentinel events are from ineffective communication, and that is a high amount. The importance of effective communication is, number one, patient safety. Patient safety with medical errors, patient safety when it comes to a patient's history. If a patient's diabetic, and that's kind of important to know, especially when you're post-surgery, and a lot of times we don't get that information, and it's very important when it comes to treating a patient. We have new and different mind and skills, and a lot of nurses have a different aspect on critical thinking skills. Sometimes we lack multitasking skills, and sometimes we can't multitask and watch our patient as we're getting a report or listening to this blood pressure, or another CRNA is talking, and we just can't multitask and listen to all of that at once. So some resources that I've come across that would be effective in the post-anesthesia care unit is the S-bar, and I've kind of tweaked it to more towards the operating room side. And so if you all don't know, this S-bar is for situation, background, assessment, and recommendations. So the first is the situation, and I've described that as the what surgery occurred. And the background's easy. Why is the patient there? Why is the patient having surgery? And any pertinent medical history that the patient may have that may affect his post-care. And what occurred during the surgery? I need to know, what the patient's ASA status is. I need to know the medical history. I need to know what medications you gave this patient. I need to know what the vital signs were preoperatively. These are all very important aspects that sometimes don't get passed along to us in our reports. And then the recommendation is the current status on the patient. How's the patient now? Is the patient, is the patient's oxygen saturation effective? Is the patient's airway open? Is the patient breathing? This is right out of surgery. Is your patient breathing? We have to go back to your basic ABCs, and we cannot take an effective handoff and take responsibility for a patient until the CRNA is satisfied with the transfer of care of this patient. I've also suggested hard stops in our computer system, and this is when we have to stop. We can't go any further in our charting until we have all of this information charted, and that is getting a report from the CRNA, and all of that has to be done before we can adequately accept this patient in the post-anesthesia care unit. And why is handoff? Why is it important? You want to optimize that information that's being passed along, and it boils down to responsibility and accountability. The uncertainty in a phase 1 recovery room, you're getting a patient straight out of surgery who, was just weaned off a ventilator or weaned off anesthesia, and the uncertainty of what could happen with that patient. The verbal structure is very important. Our checklists are important. We need to make sure all of our checklists are complete, and we need to make sure they're complete when it comes to handing off our patient. And IT support, we always have IT support, 24-hour service at our hospital, and we need to utilize that. We have a number that goes directly to a person, and you speak to them directly. They're in your hospital, and if you have any problems with anything as far as your computer starting goes, then you can always call them. Some communication challenges that we may have are distractions. We have personality differences, the amount of workload that we have. We have a varying communication styles. Some people are more nonverbal, or they speak louder, or they are hard of hearing. And then sometimes they're personality conflicts. You just don't like the nurse you're given you report to, or you don't like the CRNA that's giving you a report. And you kind of, sometimes there's a battle of the wits there. And the patient's needs. Sometimes the patient's needs interfere with report, and sometimes you have to stop report to take care of your patient. And then you kind of lose the train of thought, or you may have thought you've said something. And this is where the cheat sheet comes into play that I've recommended. And how does this affect the quality and the safety of your patient? I mean, this is very important stuff. Something missed, like a difficult airway, a difficult intubation, the amount of drugs, you gave this patient, if the patient received pain medications, and then, you turn around and give him more pain medications, well, your patient's going to stop breathing. So this is very important that we have effective communication, and we listen effectively to our CRNA, and they speak loud enough. It's a team approach. Our report check sheet. First, we get a pre-report from the circulator in the OR, and this entails, the name of the patient, the physician that is doing the procedure, the actual procedure that was performed, and sometimes it's different than the schedule says. Any allergies the patient has, it's good to know that before the patient comes in there. And any other pertinent information, if the patient has a chest tube, or the patient has any type of packing, or wound vacs, if the patient has an oral airway, or those are very important information that needs to be passed along before the patient comes to you. When the CRNA does a handoff to the PACU nurse, the procedure is confirmed that you got in your pre-report. You want to give a timeout of the OR and your ASA status. Any medications given, this is very important. Was your patient paralyzed in the OR for the procedure, and were they reversed? That's kind of important. There's many times I've had a patient come out and they're just not breathing good, and it's because they haven't been reversed, or they didn't get enough reversal, and they're still partially paralyzed. Pre-vitals, that's also an important information to get, and a lot of times our CRNAs do not give us these pre-anesthesia vitals. If you have a patient that is a smoker, and that's only 94% preoperatively, that's important to know, especially if you can get your patient weaned off the oxygen that they're on in the phase 1 recovery. Any complications that occur during the operating procedure, especially with anesthesia and airway, that's very important to know, and passed on to the registered nurse. The patient's assessment during the procedure and after they were weaned off anesthesia. And support. A lot of times we have children that are autistic, or have some sort of syndrome that, you need to know what kind of support's out there to help you when that patient wakes up, it's very important. Some of our goals, very important goals that I have come across in my project, and I hope to implement this once this class is finished. High quality of patient care. That is our most important thing, is that our patient is safe and our patient has the best quality of care that they could possibly have. And we want a high safety rating, a high incident of teamwork. You know, it's, you know, you do your part and I'll do mine, and it's very important that everyone in the PACU and the anesthesia team works as a team. And that's just for the benefit of the patient. This will improve patient outcome, decrease postoperative pain, a decrease in postoperative complications. And then, you know, you have an increased satisfaction as a nurse, you know, in your work area. You know, if your patient's happy and you're happy, that's great satisfaction. When you have good satisfaction and happy nurses, you have great morale. And you have a lower incident of sentinel events. So improving current handoff communication between the CRNA and the PACU staff will reduce communication errors, reduce medication errors, reduce handoff gaps regarding pertinent information, and lead to the increased high quality and safe patient care that every single patient that we have deserves. And this is a cheat sheet that I hope to implement into our area that will help the CRNAs and the registered nurses in our PACU make sure all information is passed along in a bedside report that we have. Thank you, and if you have any questions. Okay, thank you.